Atrial fibrillation is the most common clinical arrhythmia. It's particularly common in the elderly and in patients with other risk factors such as high blood pressure or diabetes. What we know is that there is a proportion of patients out there who have atrial fibrillation, but they don't know they have it because they have no symptoms from it. So it's these patients that we want to identify with this study. And the reason why we want to identify it is because we know that anticoagulation is an effective treatment for preventing most of the adverse cardiac event and also in particular cardiovascular event and in particular strokes that are associated with atrial fibrillation. So in this study we are proposing to record your ECG for 2 weeks to ascertain whether you have silent atrial fibrillation. The question may be, why don't we give this patch to everybody? Why are we randomizing the patch to half of the patients and not the other half? Because the answer is because we don't know that is actually cost effective. We don't know that whether with the patch we are detecting patients who would never know that they have atrial fibrillation otherwise, or we're just only diagnosing a little earlier and they would know anyway after a few months that they have it because they would develop symptoms. So this is the reason why half of you would receive a patch and half of you will not.